Welcome back, everybody, to Pivot Point of View. I'm Destri Millsap along with Becky Pearson, and the summer run is upon us. We have the fourth run coming up, so hopefully everybody is feeling their best and your horses are feeling good, and the radio season has been treating you well. And good luck to everybody during the summer run. I've been following along on the Cowboy Channel as well. So, man, there's been some incredible runs made, records broken at Reno once again in the barrel racing. So, yeah, hope everybody's doing well out there on the road. And if not, give us a call. We'd love to help you. So, today we're going to talk about dry needling. And so, most people are familiar with acupuncture, which, dry needling is not acupuncture. It's like acupuncture is more like Eastern medicine. Dry needling is more like Western medicine. So we're going to talk about that today and how we use it in our practices. You do have to be certified. I've taken the course. Becky's taken the course to be certified in dry needling, and it varies from state to state as far as accreditation and if how many hours and all that stuff. It does vary. So know the rules for your state if you're looking to get certified in dry needling. But it's a great tool to have, and I was skeptical of it, of course, at first. I was like, man, we're gonna be sticking people with needles. Like, man, I don't know. Am I ready for that? And then of course the way that you get certified is you go get stuck with needles, so you know how it feels. For in Oklahoma anyway, 27 hours of getting stuck with needles by strangers who you don't know if they've even touched a person or a dog in their entire life, and so that was quite an experience. I can tell stories for hours on that. 27 hours, but anyway, we use it for a lot of different things. So Becky, what are some of the differences that you have learned between dry needling and acupuncture, and how have you used it in your practice?
Yeah, so I've been dry needling for years in the human world, and I just started taking a dry needling course for horses. And so I thought this was a really good, timely topic for us to discuss. And so, you know, I was a little bit like you, like I didn't know if I really needed to add it to my practice, but once I took the certification, I was so glad I did because it really allows us to do so much more and to really penetrate those muscles that are way deeper than what just our physical touch can get to. And so um, the differences between acupuncture and dry needling, I get that question every time I do that on somebody that's had it for the first time. And really, it's using the same kind of needle. It's a monofilament needle, so it's a solid needle. You can't inject anything with it. And they're very, very thin, very tiny. I mean, they're the width of a hair, if you'd say. Um, and so, really, the difference is the application and the theory behind how you're applying it. Now, with acupuncture, you go to specific acupuncture points in order to accomplish balancing the energy, if you'd say. So, there are certain points on, like horses in acupuncture, that will help digestive system, help with like foot pain. It's there's a point up in the neck that helps with foot pain, arthritis, things like that. Well, in dry needling, it is applied to tight muscles that or trigger points that are referring pain to other areas. And so, if you are a person that has low back pain, sciatica, you're going to, if I'm going to dry needle you, I'm going to dry needle your low back muscles, okay, the muscles that are right next to your spine and the lumbar area. And then I'm also going to dry needle like your piriformis muscle in your hip. And so, because those muscles can get tight and refer pain elsewhere. And so, it's just more of that difference in the philosophy. I do think I read something that 93% of all acupuncture points are related to trigger points. So there's a ton of overlap. And again, it's just more of that philosophy as to why we're needling the area that we're needling. How about you?
Yes, and trigger points is one of the things that I do like to use it for, especially just in the muscle belly. And you get that twitch response, which when you hit that, it's extremely satisfying as a practitioner when you stick a needle in a trigger point and it jumps real hard and releases just that quick. I mean, it's a great tool to have, and I've really had a lot of success using it with muscle strains, and to me, it turns a muscle strain around quicker than anything that I've ever used before. I mean, the amount of inflammatory response and blood flow that you can get to that area immediately. Uh, there's just, and the neurological benefits, there's just nothing that has matched it from a muscle strain standpoint. I mean, I've turned muscle strains around in half the time. I mean, it's an absolutely incredible tool for that.
I agree. Like Gracie last year in track, she strained her hamstring. So I needled her hamstring the day she strained it, got her pelvic girdle lined up, got everything neutral. She wasn't out a bit for that hamstring strain. We just kept her on a good set of program or a good set of exercises to keep everything neutral, and then dry needled and ultrasounded and things like that as needed. So it is such a good complement. Is it the end all be all? That's the only thing you need to do? No, you need to do it in conjunction with other things, with exercises, with repositioning, with stretching, those kinds of things. But it it makes your treatments, I think, then again half as yeah, I mean, like it doubles the effectiveness, I guess is what I'm trying to say. Like it speeds up the process of healing incredibly. And I get a lot of people that they're fearful of needles, or they ask, is it going to hurt? And if they're fearful of the needles, it's probably best if they don't watch when you needle them. When I did my certification, the very first thing they had you do is you sat down and you needled your own thigh, and we had a kid pass out. And there was a reason they had us sitting when we did it. And so yeah, you probably don't want to watch it if you're squeamish about needles, but some of them don't hurt at all, and then some of them do. Some of them are uncomfortable, and when you really get that tight dysfunctional area, it probably is going to hurt a little bit when it goes in there. But the aching really does go away quickly, and the benefits of it far outweigh the little bit of temporary discomfort that you might have from us needling an area that is really tight and dysfunctional.
Yeah, we had a kid pass out during that initial needling yourself in the quad as well, and he was my partner the next day. It turns out, so that was just quite an experience. But but you're right. It doesn't take the place of anything. It is to be used in conjunction. You still have to do your pelvis repositioning. You have to do your exercises, activation, and release of stuff. But it is a great tool to use in conjunction with those things when you're treating those types of issues with the muscle.
Yeah. Now, Destry, do you dry needle before you do your manual therapy, or do you do it after you do your manual therapy?
Typically, if I dry needle, it'll be after I got them in the position that I want. If I'm say that I'm uh trying to get their hips where I want them, I'll do that first and then go to the driving lane. I don't know. How do you like to do it? Do you sometimes do it the other way where you loosen up the muscle so it'll move easier, or because it just kind of depends on what I'm doing and how much of an effect it has on that. So like if I'm doing a hamstring, I don't know. I've repositioned them to see how much pressure it took off, and then I might fine tune with the needles after that. Once that way, they're at least sitting in a good position when I do that, since the hamstring can't hold them anyway. Um, so I don't know. I mean, it's probably six one way, half a dozen the other. If you do it before or after you're repositioning and things like that.
Yeah, so I typically do it before, and I was in the minority in the PT clinic when there were three of us practicing. Andrew and Aaron, they did it afterwards, and I always did it before. And my philosophy on that was that if I kind of know what muscles are dysfunctional, I want to get them to calm down, and then I want to reinforce that with the manual stuff that I do, and then with the repositioning, because I do feel like it makes it more effective to be able to do that, and we're doing it in a very controlled manner. Now, you don't want to go out, get dry needled, and then compete like that afternoon, because you may have this newfound range of motion that actually could put you at a greater risk for injury, and it does change like the muscle spindle firing and in that whole nervous system. And so you want to wait at least about 24 hours before you would compete. If I always tell people, like, let's do the dry needling after you're done at like a barrel race. I don't want to dry needle you and then you go out and you make a run and something happens in your run and your muscles are not as you know, active as they normally would be. So it's definitely kind of goes with how you want what you're trying to accomplish, but I find it very effective in doing it before. And I know, like, with a lot of the vets that I've worked with that dry needle horses or do acupuncture on horses, they'll use that to relax the muscles before their joint mobilizations. And that's why I'm really adding it to my repertoire, because right now what I do is I find out where the horse is dysfunctional, where they're tight, and then I go in and I do my body work, my soft tissue work, my myofascial release to get the muscles to relax, and then I go back and I do my joint mobilizations, which is very time consuming. I do think it's going to be really good to add the dry needling in there. It's just going to be a matter of me figuring out that new approach, and because I've kind of got a system now with how I do it, but it really does take me a long time to work on a horse, but I do feel it's very effective. So hopefully this will help speed up the efficacy of getting the muscles to relax a little bit more.
Right, and it's not something that you use back-to-back days on the same area. There's going to be at least a day or two. I usually do a couple days in between, and we'll do other things. And you just never know how somebody's going to respond. Like, are they going to be sore? Are they just going to be sore for a little bit, and then 24 hours later be good? And so you're going to want to make sure that you're doing all the things, hydrating, and have a good plan of what kind of activity you're going to do the next day and see how it's going to affect you. And just talk to your practitioner that you're having do it and say, hey, I gotta compete in this either the next day or in a couple days, or I just got done doing this. And so we have a good idea of where you need to be at for that time. So and like I said, everybody is affected differently. Some people they get sore, some people they're good in a couple hours, and so that also plays a factor in the timing of when I try and enable somebody. And I like using it in a recovery setting too. Like some of our pitchers might dry needle their shoulder or their elbow, and then but I know that they're gonna pitch on this day, and then they're not gonna pitch the rest of the week or play a position that they'll be needed, and know when their off days are and how they take it. So a lot of things to consider there.
Yeah, yeah, it's definitely not just a one size fits all and everybody gets treated the same way. It's definitely you take into consideration everything that you have to for treatment. But the other thing that I wanted to touch on with this, it's been really interesting throughout the summer. I've had some cases, as I'm working on horses, I find that there is a ton of tightness in their back from in their lumbar spine in those muscle areas. And basically from the last rib back to their pelvis. Um, I see a ton of this. And I had one case in particular. She was being treated for chronic rear suspensory um, issues, but she just kept staying very, very tight in the back. And so it kind of led me down this path to look into like the dermatomes. And so dermatomes is like the part of the body that is innervated by the nerves of the spine. And as I started looking at that, the dermatomes in the lumbar spine of the horse's back, okay, so the low back, the area from the last rib back to the pelvis, that innervates that whole hip, stifle, hock, lower leg area. Okay. So it really started us on this path of looking at, could her back be playing a part of this intermittent lameness that she was having? Sometimes it was on the right, sometimes it was on the left. It wasn't real consistent. It would get worse when the rider would get on. And so, and she did have spots that were touching in her spine. And so, we really, we worked a lot on this mare, just thinking, it was compensation from being lame in the rear suspensory, which is kind of what the vet diagnosed her as. But she just continued to be sore up in that back. And just consulted with a few more vets on that. They really got to the point where they were thinking that the back was more of an issue. And they did just do kissing spine surgery on this mare. I'm really hoping and praying that this really takes the last little bit of dysfunction out of her. She's got a lot going on, so that's a case we'll keep you guys updated on. But it's something to really discuss with your vets. Like, okay, if it is a lower limb issue, I always say, if I'm having pain in my leg that is originating from my back and you numb my leg, I'm gonna have less pain, right? But did you really get to the point that was causing the pain? So just have those discussions with your vets about it. Have those discussions. It's not like you're trying to say they're wrong. It's just look at the whole horse and how does that affect what's going on, and just conversations to have to make sure that we're doing the best that we can by these horses.
I think that that's a huge thing is being descriptive of when you feel stuff. Do you feel it when they push out of their turn or come out of the box? Like, do you feel something there? Do you feel it more when they go into the barrel, like they aren't really getting on their hind end, and or they feel like they're more on their front end? Or do you feel it when you're loping in a circle this way versus that way? And at what point? I mean, just being able to be descriptive, because those movements all involve different muscles. And so that way you can dial in where that's actually coming from. And it is helpful if you have somebody who thinks mechanically and can use that information effectively. And
Yeah.
the mare that she's talking about is an incredible. I mean, she is a winner, 100% winner. And that's one of those things that we've talked about with people. If you can have a surgery, but if you don't, like, if it's seemingly non-traumatic and more of a chronic issue and you have a surgery, if you don't fix what was causing that chronic issue, what biomechanical thing or whatever was causing that issue, if you don't address that, you're going to be right back in the same boat without the same paddle, turns out. So, and I don't know how much information is out there on the horse world with that. On the human side, Becky and I, we mainly use our knowledge of biomechanics and how different things affect different areas, and can hopefully that also helps them in the rehab process recover
Mhm.
quicker, I think too. But on horses, I don't know um, how much of that is practice. I don't know. What do you think, Becky?
I think there's a lot that we can bring to the veterinary world with our experience from people, and we just have to be able to find, the veterinary professionals that will be willing to talk to us about this stuff, and engage in conversation about, the I mean, how many times do you visit with a vet that you say, okay, in a person, this is how I would handle it? And it's great to have that dialogue back and forth. And I really hope that the veterinary medicine world will get to that point where we can all collaborate. It is getting to be more prevalent. Dr. Kevin Hausler, he hosts this group that's called the Compendium, Equine Compendium, and it's basically bringing all healthcare providers for horses together so that we can bounce ideas off of each other. But the veterinary world can be a little bit, um, just a little bit closed if you're not a vet. Sometimes they don't always want to talk to you about these things. And so, for example, I tried to get into a equine acupuncture course, and with my credentials as a certified equine rehab practitioner and the years of practice that I've had and the physical therapy background, but they wouldn't accept me because I wasn't a vet. And so I had to find another course that was willing to take me. And to me, it was just, nope, you're not a vet, you can't come here. And so if we look at that from a medical world, a human medical side of things, the doctor doesn't do everything. The doctor doesn't do the rehab. The doctor doesn't do, exercise prescription. There's so many other uh, healthcare practitioners that help get that patient better. And I would really love to see the veterinary world um, work together with other healthcare practitioners in the animal world too. I think it is improving, but I do hope that we can all try to work together to get this better for the clients that we have. And so, if you're a vet listening, please keep an open mind and help us learn together, because we have these nonverbal animals that we're trying to help, and so we're all just trying to do the best that we can. So it'd be great if we could learn from each other on this stuff.
Yeah, and we're not saying. I mean, I know I have some close vet friends that I bounce ideas off of all the time, and they love hearing like, "Oh, well, that's how that works in a person. I bet it would work this way in a horse." I mean, Dr. Kim and I especially, we bounce stuff off each other constantly, and it's always fun to hear how she does stuff in horses and how I can apply it to humans. So there is that dialogue there, and it is coming along, and you do have those special people, Dr. Dovey as well. Him and I have multiple conversations on sports medicine for horses and for people, and how the two worlds cross there. And then Dr. Kim and I's conversations are just like very in depth on all the things, all the systems that are affected. And so, it's always fun to me to be able to see how those two worlds meet and see how the rider affects the horse. Especially for me, that's the big thing, is how does the rider affect the horse, and where the human is locked up, how does that affect the horse's performance? And so and for instance, like somebody who has been locked up in their hips that I worked on recently, who couldn't really feel their horse take a certain lead because their hip was so locked up that they couldn't feel that movement and hadn't been able to for a long time. And then we unlocked that hip finally in a way that hadn't been done. And now they can just like have so much more feel of their horse, and they've rode for their entire life. And so I think that just that type of stuff has been really fun. And we just want to help. Like we're not trying to take the place of anything the vets are doing. It's just like you always got to have orthopedic surgeons and you always got to have physical therapists. And I think it's unrealistic to think that an orthopedic surgeon is going to be expected to do acupuncture, chiropractic, the teeth, the feet, everything. And you just know what? And it would take away from their ability to diagnose and treat in the way that they do it because there's already so much that they need to know in general, you know. And if they have some of this knowledge, that's great because it's only going to help them from a diagnostic perspective and a functional surgical perspective. But but there's a reason that we have specialists in each area. And I think that would be the argument that I would make if I would talk to the veterinary boards that are resistant to human practitioners becoming animal practitioners.
Amen. Yeah. I think it'll get there. It will, the more conversations we have, and those of us that are in the human world trying to do work in the veterinary world, making sure that we are getting legitimate education and going to places that are really on the up and up. It's not just a, backyard kind of thing that we're signing up for a certification, but going through the right channels to get educated, and then having those educated conversations. I think it definitely will get there. So, but yeah, that's kind of what I have on the differences in acupuncture and dry needling, and a little bit of touching on that equine dermatomes. And so, yeah, if you want to search up a huge rabbit hole, go look at equine dermatomes. You will find charts that are crazy, they vary just greatly from each resource. And I think, again, that's kind of that we have a nonverbal patient that can't really tell us exactly, where everything hurts when a certain area is stimulated. But I think it's good thought process to have when we're taking that into consideration with the horse side of things. And if you've ever thought about trying dry needling for yourself for an ache or a pain, don't hesitate to do it. Just make sure that you tell your practitioner, if you have an aversion to needles, just let them know that, and so that they can take the proper precautions. So hopefully you don't pass out and make a mess of everything. So just make sure you don't look, you don't watch.
Definitely don't take a needle standing up. We'll lay you down, we'll put you, or we can at least catch you, or you can catch yourself. So
Absolutely.
anyway, well, I'll close it out. Thank you all for listening, and thank you for all of you who've supported us and liked and subscribed our YouTube channel, Spotify, wherever you get your podcasts. Follow us on social media for what we're doing and what we have going on next. And again, thank you all for listening and all of your support. And as always, let your health be the pivot point to your success.